following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello, I'm Carl Seidel, host of The People's View. The show is sponsored by the Nashua City Republican Committee, and if you like to attend our meetings, they're the second Thursday of every month at 6:30 at the Crown Plaza. And if you want to find out more about our organization, you can go to nashuagop.org to see our website and learn about the events that we have.
Welcome to The People's View.
Hello, everybody, and help me welcome Senator Kelly Ayotte.
Carl,
Senator,
it's great to be with you. Thank you.
Nice to see you again.
Nice to see you as well.
You've been busy campaigning, I know. You helped us out on the First in the Nation meeting here in Nashua last weekend. So how did you like that? That went over real well.
Well, I liked it. We had so many of the presidential candidates there, and it was a town hall format, and there was a very good crowd. So I think it was a great way to do it. I mean, New Hampshire, you actually, we ask the hard questions, got to get out there and answer them, and I thought it was a great turnout and a good way for people to see a number of the candidates in one day and compare them as they're coming to their final decision.
A lot of people come here. I don't know if you knew how many people from out of state came, as far away from Oregon, Florida,
right.
Virginia.
That's one of the great things. I mean, obviously the New Hampshire voters, we're the ones participating and voting in the First in the Nation primary, but I've been so surprised. I mean, if you want to see the presidential candidates up close and personal, people come from a long way to experience the New Hampshire primary.
So you played a part in a lot of the primary stuff, aren't you? What are you doing besides making an argument for re-election for yourself? Yeah,
no, I've been obviously continuing to work hard to represent New Hampshire in the Senate. And when there are forums like the one Saturday, I appear, and I've been wanting to welcome all the candidates, make sure that the people of New Hampshire's role is respected, and that we continue to have the First in the Nation primary. So I always fight for that. And I think it's just wonderful this time of year during the presidential election to have the opportunity that we have here in New Hampshire. And I know that our voters are going to take that very seriously.
You've been helping a lot down in Washington, and hopefully we're getting a turnaround down there a little bit. But you've worked with the drug problems and things like that.
Right. I mean, I know now in the state legislature you're working on those issues, and I've been focusing on it for the last 2 years in the Senate, and so pushing hard, working on leading efforts on a bipartisan basis, including what's called the Comprehensive Addiction and Recovery Act. And actually, we are having a hearing on it this week, tomorrow, the bill. And the Manchester Police Chief, Nick Willard, is going to be testifying in that hearing on behalf of New Hampshire to talk about our opioid crisis and how do we focus more on prevention. We know we've got to get into the schools, we've got to get the word out of how addictive heroin is, and obviously making sure that people don't, and especially our young people, don't start with it, and also prescription drugs and overusing and misusing them. And so CARA focuses on that, prescription, on making sure we have prevention and on both prescription drug and misuse, as well as heroin, as well as treatment and intervention, critical, and help for our first responders. We know so many of them are out there saving lives, administering Narcan. I've been on ride-alongs with them. It's astounding. They're bringing people back to life, but once you bring someone back to life, they need the treatment when they're struggling with addiction. And so it's really looking at this in the big picture. So I've been pushing the effort at the federal level. And at the end of the year, the spending bill that was passed, I certainly pushed hard. There are more resources for this opiate issue, both on prevention, treatment, and first responders, which is critical. So I'm going to continue to push that effort in the Senate and make sure New Hampshire's voice is heard there. And that's been actually, Carl, really terrific to see our presidential candidates on both sides of the aisle understanding that this is something that very much matters in terms of the quality of life of people in New Hampshire.
Definitely. It's sort of gotten out of hands real quick.
Right.
And I know here in the state we did pass a couple of the laws. We got hung up on one,
Yeah.
on the education, and basically that's just a question of we wanted local control, and you didn't want to have something coming down from the top. So the word shall means that the state can do things, and sometimes they can do unfunded mandates, and that was one of the big objections that we had here.
Right. Well, and I know, though, that the schools are a critical piece. And
Right.
the thing is, the national legislation I'm working on would, if passed, give more resources for
Oh,
the
that's good.
state and localities. And I agree that how do we do prevention? We have to make sure that it's evidence-based, it's the right program, but also how is that message delivered? That local piece does have to be an important part of it. So that school boards can be engaged,
That's
parents,
right.
teachers, that is important. And so hopefully we can also get you some help from what we're doing
Oh, that'd be good.
in the Senate as well. I wanted to mention another issue that I know that the legislature is working on, and it's something that I've had legislation on at the national level for over a year, and that's fentanyl. So this year, we've had just a tremendous number of drug deaths. The estimate of the chief medical examiner was close to 400, and he's attributed about 150 plus of those to not just heroin, but it's a combination of heroin and fentanyl. Fentanyl is 50 times more powerful than heroin. And one thing that the DEA brought to my attention is the penalties for fentanyl and heroin, they're not lined up.
Right.
In other words, it's so much more powerful, it's deadly, and if you're dealing in it, you aren't hit as hard as you should be. And so I've got legislation to do that at the federal level, and I know you're working on that at the state level. This is important because those drug dealers who are mixing this deadly fentanyl with the heroin, they need to be held accountable for the fentanyl.
Oh, definitely, yeah, and it's something that they probably don't even know what they're doing.
Well, unfortunately, and the people who are trying to make the money off this, I don't think they care, and they're killing people.
That's true.
So that's why on this piece, we've got to make sure that the penalties reflect how deadly the fentanyl is.
And one other area I think you helped out in too is the mental health issues that are going on.
Absolutely. Mental health is so critical.
It is.
We know that it's about our quality of life. We know that it's also related to the heroin and opioid issue, because many of those who are struggling with addiction also have co-occurring mental health issues. And then, of course, making sure we have early intervention. So I've been leading the effort on what's called the Mental Health First Aid Act. There are additional resources when we focused on this at the end of the year in rewriting the education bill. And I'm going to continue to push this effort because our mental health system needs significant improvement. And when we think about the challenges we face in terms of our quality of life, if we have early intervention, how many of these situations where unfortunately we've also seen where people who had mental illness at times turn to violence or other issues, if we could get an intervention earlier, get them help, hopefully we could turn those situations around. And also just for people who are struggling with mental illness. I mean, people who struggle with mental illness, how do we get them help so that they can lead quality lives? It's so important.
And to have this included in regular insurance programs a little bit more.
Yeah, no, so this is a really important issue, both for the substance abuse issues and also mental health issues. There's a federal law, it's called the Parity Law, and it basically says, and I know some of our presidential candidates have talked about it, but basically says if I break my leg and I get health care coverage for that to fix my leg, well, guess what? If I have a mental illness or if I'm struggling with addiction, that is treated the same under insurance as if I had cancer or if I broke my leg, that I should receive coverage. If I have insurance coverage, that coverage needs to treat the same, the coverage for mental illness, for those struggling with addiction. And unfortunately, it's been unevenly enforced. So at the federal level, I've been pushing to hold the insurance companies accountable and have this law enforced. And then I know that this is an issue at the state level as well. So the law exists.
Yeah, but it's not being implemented.
It's not being enforced evenly, and this is critical that our insurers do it so that, listen, if you've got mental illness, if you're struggling with addiction, you get the help and you get your life back on track, and instead of being told, no, you can't have treatment for it, you can't have help.
I mean, there's two parts of that issue. One, I think, is the young people who have mental health problems.
Yes.
They're very hard to treat because they're growing up, their hormones are straying,
Of course,
everything.
and honestly, you're right. It's hard. We need early intervention.
That's
We
right.
need to have the signs. That's why when I've been pushing mental health first aid, it's about helping people get training early on, not just the professionals, but in the schools. And for parents, how do we know if there's an issue, and how do you get early intervention to get help for someone? And for young people, we need to make sure that obviously they're being treated, they're young people, and that's going to be different perhaps than treating an adult.
I found out that Harbor Homes here locally is working with a lot of
Yes.
profit agencies, and they tell me that they're one of two agencies that are actually piecing together these things into a group, so you have a full treatment plan. So
No, it makes sense. The Harbor Homes work is very important,
Yeah.
and I think to have the full treatment plan so that someone doesn't just fall through the cracks, and we really get them back in living a quality life and a healthy life.
One thing that bothered me a little bit is they told me that if they get Medicaid help, they are able to get a supplement payment for treatments of mental health people who need to stay there for a couple of days until their medicine gets treated right. And some insurance companies cover it, but not all of them.
Well, this is the issue that I want to raise.
Yeah.
Is it's about the parity
Right.
law. So there's been inconsistency on how the insurance companies have treated this. That's why at the federal level, I've actually called on the Government Accountability Office to do a full audit of how this law is being
Oh, really?
enforced.
Oh, good,
Absolutely.
good.
Because you do see inconsistency. It is the law. It is the responsibility of the insurance company, if you have insurance, that you're entitled to coverage to it. So this is something to me that we do need to focus on at the state level and the federal law to get this right.
I know we're going to have a big discussion starting this week on the expansion of Medicaid here in the state and how it covers everything. I think for the most part, Medicaid alone it doesn't treat the patients as well as it should, and the doctors, I know, they don't even get coverage for their overhead
Well,
costs.
one of the issues, I know this is an issue that the state legislature has to take up, and also, whether physicians are going to take on these cases, that's critical as well.
Yeah, yeah. Well, let's go to something a little bit more pleasant for it. You helped out a lot on the highway bill.
Yes.
And that's a big thing that we need here. I think the two big issues are the drug problem and the infrastructure problem in New Hampshire. And I'd like to thank you for your work on that.
Well, thank you, Carl. And we finally, one of the things since I've been in the Senate, because I have been frustrated that, some of the bills, the way they've been funded, have only been very short term, only up to 2 years. And it's one of those deals, like some of the earlier bills, 2 years of funding paid for over 10 years. And obviously you can't plan roads and bridges over 2 years. So we finally this year, and this is something I've been pushing for, we finally did a 5-year funded highway bill.
Right.
So that the state, when it looks at its transportation plan, the localities like Nashua, they know that for 5 years, the funding is there from the federal level. They can look longer term and in their planning process for transportation infrastructure projects. And let's face it, this is important to our economy. This is about jobs. Every business needs good roads and bridges to get around, and all of us. So
Especially in the winter.
Yeah, exactly. So one of the things I wanted to say is, this is when right now Republicans are in control of both the Senate and the House, and we put this together for 5 years and got the Democrats on board, did this on a bipartisan basis, and it was important for the state and for Nashua.
Yeah, we have a 10-year plan. The joke was we're lucky to have 5 years of, but now we have at least the 5 years.
Right, at least you can know that this funding piece for 5 years is there, and that's how we have to keep keep doing it so that you can have the certainty going forward.
Yeah, there's a lot going on here, and in both not only the roads and bridges, but the rail and the airports too.
Yeah, no, there's obviously infrastructure is important to our economy, and
right.
glad we did that.
So how is your campaign going? What are you doing next? Because you've been active around here doing town hall meetings almost as much as the presidential people.
Yes. Well, you know, I like the old-fashioned town hall
Right.
meeting, and I've done them since I got into office.
Uh-huh.
And in fact, you know, I do them in every county and in person, and then I also do some telephone ones too. I try to do. It's important to hear from people, and so what I've been doing is just getting out and working as hard as I can on behalf of the people of New Hampshire to be their voice in the Senate and to fight hard for the issues that matter for New Hampshire and for our country. And so that's what I'm doing. I think the best thing I can do is really work hard for people in Nashua and the whole state.
Well, how is this program going for immigration and for the problems we have? We're worried about infiltration by ISIS or something like that.
Yeah, so last week in the Senate, we voted on a bill that actually the House of Representatives had passed a similar version, and it really puts more teeth in the vetting process and increases the manner in which both the FBI and the Director of National Intelligence weigh in and vet refugees that are coming from both Iraq and Syria. And because we know that this is a very important issue, we know at least one of the Paris attackers came in on a refugee status. And we want to make sure that if anyone comes to the United States of America, that we can guarantee that they are not involved or engaged in any way with ISIS, and that's critical to our security. So we didn't pass that last week. We voted on it in the Senate, and actually, unfortunately, the Senate Democrats blocked it, so we did not get a final vote on it. But I'm going to continue to push for this because it's just common sense.
Well,
It's common sense that we're a very welcoming nation, but we need to make sure that we can tell people if someone's coming here that they're not engaged in ISIS, that we've taken the precautionary steps to ensure we're protecting the American people.
Well, that's why we're protecting our borders just from the south, not even to ISIS. You're worried about drug dealers and other criminals
Carl,
that are
let me put in perspective the heroin crisis. People ask me, where's it coming from? Guess where it's coming from? It's coming over the southern border. It's coming over from Mexico by the sophisticated drug cartels that are trafficking it up. They're trafficking it at places like Lowell and Lawrence, and then it comes up to New Hampshire. And so as we think about, let's get help for the people who are addicted. They flooded our markets. Heroin's unfortunately cheap on our streets right now. We've got to actually have more border security. We've got to go at the interdiction of these sophisticated cartels that can traffic. They traffic in heroin, but they also can traffic in almost anything. So it's a security issue for us.
Sure.
And I've supported more support for the Southern Command, for interdiction from our Southern Command military, the Coast Guard, and obviously efforts in the Senate to secure our border. That's important, not just about security and terrorism, but about heroin too.
We haven't had any problem coming from the north, though, have we?
Well, obviously, one of the things that I've also focused on in the Senate is the northern border, because it's right on our border. It's our border.
Yeah.
And so myself and some other senators who are border states have actually made sure that we're focusing on ensuring that there aren't problems on our northern border too. It's not the extent of we have obviously on the southern border, but we need to make sure Canada is an important partner, and a lot of tourists come back and forth, and so we want that. That's great for our economy, but also making sure that we still continue to make sure that we have that support for the northern border as well.
Because that's, I understand it, with the largest unprotected border between two countries.
Well, and it's a large border with obviously between Canada and the United States.
I know, I crossed the border there once unintentionally without going through the...
Right, so we cannot ignore the northern border. It's important for security, but it's also important for our economy. And so I've certainly, as we do in the Homeland Security Committee, I've been focusing on the northern border as well.
Well, Homeland Security has a no-fly list. How is that working now? Because I think the major complaint is that people get on it that shouldn't be on it and have a hard time getting off it. Is that going to be any better monitored or?
Yeah, this is actually an issue that I've certainly been looking at and focusing on. The no-fly list is actually a much smaller category of the overall terror watch list. And I've actually had classified briefings on both and making sure that we have the right procedures in place. They have made some significant improvements from when they first started this list in terms of vetting and who ends up on the list. So, I mean, think about when they first stood up the Department of Homeland Security, this was something where when they established these lists, they were not as, in my opinion, carefully vetted as they are now. And, but there still needs to be protection in place. You've identified there still are situations where people can get wrongfully on the list as Americans. And we need to make sure that there's due process for people to get off the list properly. And if you think you're wrongfully on the list, to have an opportunity to challenge that and get off the list. And that's just basic protection of people's constitutional rights.
Yeah. And, but you have it's a hard thing to really determine what some of these people are doing. I mean, I don't know where you get all your information to determine somebody who goes on or somebody.
Well, what they're doing is they're taking information from our intelligence agencies and investigations, both the FBI, other intelligence agencies, and putting it together, and that's how they're making the determination of what goes on the list. That said, it's never a perfect process, and that's why it's important that we have the due process. And so if someone is wrongfully placed on the list, they have a process they can follow to protect their rights and get off the list and make their case as to why they're not properly on this list.
Well, I hope our security people really can find the information they need to. I mean, as you said before, people coming in from the Middle East, it's awful hard to determine what they did before they came here.
Well, this is one of the issues in particular with the Syrian refugees, is that our FBI director, also our director of national intelligence, the FBI directors essentially said that we don't have a lot of information about the Syrian refugees. And what he said when he testified before the House was, he said, listen, we can query our databases till the cows come home, but if you're querying, if you don't have, it's only as good as the information you put in. If you don't have a lot of information from Syria, which unfortunately we don't have as much as we would like, and you query and nothing's there, it doesn't mean you don't have an issue. And that is why, certainly I've raised this issue about the Syrian refugees and Iraqi refugees. Make sure there's thorough, absolute vetting where we can guarantee to people before anyone comes here that they're not engaged with ISIS. I think we owe that to the American people. If you can't guarantee it, then sorry, we're not going to let you in, because that's a basic security measure that's important for us.
I hope nobody's thinking of people over there in Syria of making up false identification so that they can get some people in here. That's,
well, I think that we need to be vigilant, because ISIS is quite clever. I mean, if you look at the Paris attacks and what they did there, it's obvious, and some of their other attempts, and also their efforts. We know their inspiration, unfortunately, of people here, where we saw with the San Bernardino attacks in our country, that they're inspiring, using social media, people here to self-radicalize and to commit attacks. And so we absolutely have to be vigilant, and we can't think that, of course, ISIS could, if they wanted to, really focus on false documents. Why not? Look at all the other things they've done. So we have to think of each measure in protecting our own country and our own homeland security.
Well, how do you see things going now that we have a new Speaker of the House and moving in that direction of trying to break up the barriers or something? He did a unique thing by coming out with that the omnibus bill and trying to clear everything else so that he can start putting in some legislation that maybe was controversial, but at least get it out and have some debate on it when there was no debate on it before.
Right. I mean, first of all, I think Speaker Ryan is obviously he's a very capable leader, a very smart policy individual, and so I'm glad to see him in that position. And I think already, if you look at the way he is conducting himself, he really wants to focus on solutions for the American people, and I think that's positive. And I know that I look forward to working with him in the Senate on issues that obviously, how do we make sure that people have an opportunity to have better paying jobs? And so much of what happens in Washington actually makes it more difficult. And Speaker Ryan, to his credit, he wants to focus on how do we have a better tax code to keep jobs here and grow jobs here, and how do we make sure that we have the best climate for job creation here. And I think that he is someone who we will look forward to him having a positive agenda for the country. And one thing I wanted to point out about the end of the year spending bill, this points to what I hope we can do this year, and that is regular order. So the way that this is supposed to be done is 12 appropriations bills. And unfortunately, the Republican Senate actually did, their Appropriations Committee voted all 12 bills out of committee. And as we tried to bring each of them to the floor, the Democrats blocked it because they wanted to spend more on domestic spending. And so what ended up happening is everything got roadblocked and lumped together at the end of the year. Well,
you can't operate
it
that
should
way.
not operate that way. This year, there should be no excuses. We came to a budget agreement on the top line numbers, so we should let the process go where each of the 12 appropriations bill come to the floor, let people debate. Let's offer amendments. If you think that this is wasteful spending, let's offer the amendment and strike that. If you think this is a valuable program and needs more priority, let's do that. That's how this process should work. And I know that the Speaker and our leader has talked about that and wanting to do that, and I think that's what needs to happen.
So you think that's going to go ahead then?
Well, I know we're going to push for it.
Okay.
And I would hope my colleagues on the other side of the aisle would want this too. Why would we want to lump all these bills together? Why wouldn't we have greater oversight over the spending on behalf of the people, the taxpayers' money?
That's right. Yeah, you get the detail there and you follow up and see that it's being spent right too.
Exactly.
know-
More scrutiny, more
That's
time
right.
spent on each bill, and more opportunity for everyone's voice to be heard. So that if you have an amendment, hey, listen, we should do this, we should improve this, we could save money here, let's get that to the floor and debate it.
What about some of the bigger issues where you're talking about several different departments or agencies that are working on the same problem?
Duplication. So I have a bill I've been pushing hard on. It's called the Duplication Elimination Act. And it's actually bipartisan. So Joe Manchin, who's a Democrat from West Virginia, is my lead on it with me.
He's a good man, yeah.
He is good. And so what he's focusing on, and I'm focusing on, is we have all these reports done by the Government Accountability Office that show waste, duplication, fraud every year. And we don't want them to sit on the shelf.
Right.
So we actually put in a bill that would force us to vote on those, and first force the executive branch. You decide which programs are worth keeping and not keeping. You give it to us, we'll vote on it, and we have to do that within a defined time frame.
That's great. I didn't even know that was
Yeah,
going on.
so I'm
That's
pushing
great.
hard. It's in the Homeland Security Committee right now to get this bill to the Senate floor. It's common sense, Carl.
It is.
So much work has been done of, if multiple programs from different agencies focusing on the same thing. So why aren't we evaluating that? Which ones work, which don't? Why do we need them? Why do we need all of them? Is there one that's better than another? So that work needs to be done, and so Joe and I have been pushing to get this bill done. Common sense.
Good. Maybe you ought to send me a copy. I want to run to put that in in the state here because I think
I'll
we have
send
to
it
do
to you.
that.
Absolutely. Yeah.
We have the HHS group, which is 42% of the budget, and I think they're just too big. And I think we need to look at it that way too. I don't know if you remember.
Or at least to force an evaluation of.
That's right.
As
So
Ronald
a little
Reagan once
formally.
said, there's nothing closer to eternal life than a government program. Well, we need to
That's right.
evaluate these things,
That's
right?
right,
I mean,
yeah.
on behalf of taxpayers, does it work? Should we be spending our money? Are we getting results?
Is there a better way of doing it?
Yeah, is there a better way? And are we getting results for people of what we're
right.
trying to accomplish?
And, what I was going to bring up as the example that was on 60 Minutes a couple years ago when they found all of Medicare fraud down in Florida.
Yes.
What's happened? I haven't heard of a solution yet. I've heard people say that just as bad as it was before. So what are we going to do with that? I mean, that's a lot of money there, that Medicare.
Huge money, and each of those programs, both Medicare fraud of making sure that people who aren't manipulating the system, so the people who really need it get it. And there's a number of steps that we can take. Let me tell you about an area I've been working on.
Oh, okay.
So in our tax code, there are examples of fraud where lots of money goes out the door. One we have, it's called the Additional Child Tax Credit. It's a refundable tax credit if you're within a certain income level, you can get up to $1,000 per child. Well, guess what? To get this refund, if you're filing the tax return, you don't have to put a Social Security number. If you're seeking it for a child, you don't have to put a Social Security number for each child. Carl, if we just had that for each child you put a Social Security number, do you know that we can save $20 billion over 10 years?
Oh, boy.
I have a bill to take that money and put it into roads and bridges.
Yeah.
I'd be happy to put it into reducing the debt.
Hey, there we go.
Whatever we did.
Yeah.
And you know what they found? Because you don't have to have a Social Security number for the child. When there have been investigations of this, we've actually found that people are claiming children that don't live in this country. We don't even know if the children exist.
Oh, great.
Because there's no accountability. And it's money that is being sent directly
that's a
out the
simple
door.
thing
Can
anybody-
you say common sense?
Yeah.
And so, believe it or not, I've had this bill for a while. I've been pushing this issue. So you're right. Is there many more things we could do that are just common sense to save taxpayer dollars? And obviously, as we look at programs that need to be sustained, that actually go to the people that need the help, that's just one example.
Yeah. Well, boy, there's a lot of work to be done down there.
There is a lot of work to be done.
We have to get some people like you who want to go down there to go out and dig out some of this dirt and change it.
Well, that's what we need to do.
Okay.
And we have a great country, but we know that our government could be much
Much
better,
better.
more efficient, more accountable, and it's taxpayer dollars. It's, the people of Nashua are paying this money, and
That's right.
people of New Hampshire, and my job is to get down there and make sure that people are accountable for it.
Do you think it's more effective if the federal government, instead of trying to develop some of these programs, just ask the states to do it? And
I think you raised such an important point. You think about some of the things that the federal government does, let's face it, if those resources flowed locally into the states, we would have programs that are better run, more local, and maybe what works for Nashua is not what works in Portsmouth. And why wouldn't we want to design a program that the people of Nashua come together and say what is the best for us trying to solve our problem? To me, that makes complete sense.
It's a lot different between southern New Hampshire and northern New Hampshire, too.
Of course, yeah. No, when you're in the north part of New Hampshire, obviously the issues are different than the southern part. Yeah. And so that's why, Washington doesn't have all the solutions. Right. New Hampshire. And making sure that our voice is heard in Washington instead of Washington telling us what to do all the time.
Right. I mean, that's just what we're saying when we're dealing with any of the education programs.
Well, absolutely. You're absolutely right. And one thing that we did do this year in the Republican Congress is finally did a rewrite of No Child Left Behind and actually gave more local control. And actually, instead of the federal government tying the money to what kind of accountability standards that states had and really dictating too much to the states, we have now given more flexibility and local control there. And to me, that was an important step in the right direction.
Well, it's good because I saw the kind of ridiculous situation we got in when they're dictating the menus for the kids' lunches.
Well, nothing makes me more upset than that, Carl. I mean, you should see what Londonderry's gone through. They've now gotten out of the school lunch program.
Right,
and then the federal government tried to say they were a food processor, which would have cost them much more money. So we had to fight that. But you know what? It really shows. I visited, for example, the school in Londonderry, and there were kids, like in their lunch program, they weren't eating it, they didn't like it, and so why aren't we at the local level making sure we obviously have a real interest? I'm the mother of 2 kids, and we have an interest in making sure our kids have nutritious luncheons. And unfortunately, you know, with Washington saying you've got to do it this way, that way, and tying this money to it, it doesn't allow the people locally to say, we want our kids to have good, nutritious meals, and this is the best way for us to do it. So that is a great example of really where there's been an overreach from DC. Yeah. And I've been certainly fighting that because I really believe that the people locally are going to make sure and focus on, if they take those resources and say, here's how we can give the best nutritious lunch for our children. And especially parents. I mean, parents, we're going to be asking those questions.
Sure.
And wanting to make sure that that happens.
Children and grandchildren, make sure.
Of course.
Well, Kelly, I really appreciate the time that you came here. So, Senator, do your job down there.
Well, thanks, Carl. I'm so glad to be
much.
on with you, and thanks for your work as well at the state level.
Thank you. Thank you very much, and we'll have to get together again, and maybe we'll do it by Skype.
Oh, let's try it. That would be excellent.
Okay,
Thanks,
good.
Carl.
Thank
have
you
a great
very
day.
much. Yeah.
Thanks.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.